Tutti noi conosciamo l'impiego della tossina botulinica per la medicina estetica, anche per le patologie neurologiche, per la sua importante azione di tipo miorilassante. Qui a Barcellona, nel corso del secondo International Symposium of Intra-Articular Treatment, se ne è parlato invece per un impiego completamente diverso, cioè per la terapia dell'osteoartrosi, quindi una patologia degenerativa. Ne parliamo con la professoressa Boon della Mayo Clinic americana, quindi uno dei centri medici più importanti al mondo, che ha tenuto appunto un'interessante relazione proprio su questo tema. Professor Boon, why you decided to test the botulinum toxin for this type of usage?
So there's quite a bit of basic science research that has shown that botulinum toxin interferes with the release of other neurotransmitters besides acetylcholine. Acetylcholine is the one that we know about that stops the muscles from contracting. So it's well known in the use of botulinum toxin for cosmetic reasons and for managing spasticity. But we also have seen that it interferes with the release of some other neurotransmitters like glutamate, substance P, various neurotransmitters that are involved in pain pathways and also inflammatory pathways. So that led us to think that it should maybe be a modulatory agent in osteoarthritis or inflammatory arthritis.
And you have encouraging results in animals?
Yes, there's been some basic science in animals which shows interference with the release of neurotransmitters, but then there's also been a couple of more clinical based studies where they've been able to show decreased pain, poor tenderness, that type of thing in a mouse model, and improved function, for example, improved wheel running after they've pre-treated mice with botulinum toxin and then induced an inflammatory condition.
How it was administered, which type of usage, of dosage, has been studied?
So I can't really comment on the dosages in animals because it really doesn't transpose to humans, but in humans we've typically used doses of, at least in large joints like the knee, 100 units to as high as 200 units of owner botulinum toxin. You've got to be very careful because all the different botulinum toxins have very different dosages. So the one that I'm most familiar with, because that's what I use in clinical practice the most, is Botox. And those doses we've used 100 units or 200 units.
So are dosage comparable to the dose used for cosmetic or for neuro?
Yeah, so when I use it for spasticity in patients, I use between 100 units and 600 units depending on how many muscles I'm treating. So yeah, certainly it's within the realm that we know is a safe dose. And we haven't seen any concerning side effects at all. We are injecting it into the joint, so we don't expect it to travel anywhere else, and it really doesn't seem to have in the studies to date.
Starting from this encouraging result, you are studying the product in a larger clinical study. Could you please tell us something about this study?
So yes, we finished a study in 60 patients with knee osteoarthritis 2 or 3 years ago. And then felt that we really needed industry to look into this further because it's quite expensive to do these studies and you really need large numbers. So there is a study that one of the pharmaceutical companies has completed the data collection on, and I believe they have 60 patients per group, and they injected botulinum toxin, 200 units, and then the other group they injected a placebo. And they are following that up to see what type of effect it will have.
When you suppose this data will be available?
So I'm hoping to see the results out at least in an abstract format by the end of this year or early next year.
Okay, so we hope they will be positive.
Yes.